welcome to HealthLink, a program connecting home, community, and healthcare. My name is Carol Merton, and today I am delighted to welcome as a guest to our program Heidi Lucas. Heidi is a public health nurse at the Grey Bruce Public Health, and we're talking about a very important subject relating to harm reduction, and that is about harm reduction drug testing strips. There's been a pilot that's been going on through the health unit, and Heidi's here today to tell us about the project and also about the results and what they found as a result. Heidi, thank you so much for joining me today.
Pleasure. Thank you for having me.
I'm really looking forward to the information that you sent, and you've been so kind to send me questions. That makes my job so much easier, so thank you. So I guess let's go to the very, very first one. And what are drug test strips? What drugs do you test for, and how did this all start in the first place?
Certainly. Thank you. Yeah. So drug test strips are a harm reduction tool, and harm reduction is all about reducing the harms associated with substance use and keeping people as safe and healthy as possible. Drug test strips are single-use disposable strips that can be used to detect the presence of certain substances in a sample of drugs. And we offer kits that can test for fentanyl, which is an opioid, xylazine, that's an animal tranquilizer, and benzodiazepines, that's a group of sedatives. The strips can be used to test drugs in pill, crystal, powder, or rock form. So to test a drug, you just collect a small sample. This might be even too small to see in the cameras. A small sample of drug, dissolve it in water, and then the test strip is just dipped in for 10 seconds and then laid flat for 60 seconds, at which time 1 or 2 lines will start to appear, indicating a positive or a negative result.
So I'm going to ask you questions as we go along. This drug testing, how did you come up with the 3 drugs that are being tested for? What prompted that selection of drugs?
It was actually through the Ontario Harm Reduction Distribution Program. So they were the ones that offered one-time funding to Ontario health units to test for fentanyl, xylazine, and benzodiazepines. That's what was offered. And they are relevant tests because we are seeing more of these substances in the street supply of drugs. So I'll just quickly tell you about each of those substances. The fentanyl is a toxic synthetic opioid, and we're actually seeing reports of fentanyl contamination in unregulated stimulants and unregulated cannabis. So this is very concerning because people using those substances may have zero tolerance for fentanyl and may be unaware of its presence, so accidental exposure could be fatal. Xylazine is a tranquilizer, and that's intended for use with large animals. Xylazine is also being found in the street supply of fentanyl, and it increases the risk for overdose, injury, and death. And then finally, benzodiazepines, that's a group of sedative medication used to treat anxiety, insomnia, and alcohol use disorder. And since early 2020, benzodiazepines have become increasingly common in the street supply of fentanyl. And again, it increases the risk of overdose, injury, and death.
That's really helpful to understand the 3 that you're testing for, because it sometimes can be a very, very much a moving target, right? Where the drug supply changes. Now, when you talk about the testing, and you showed us how to do that, which is great. Now, do people come in, like, how does it work? Let's say so take me from the beginning, walk me through the journey. I've obtained some drugs, not through my doctor, but other ways. Walk me through the journey on why would I even want to have this tested? Do I get tested at the health unit? Do I take it home? What do I do?
Yeah, so you've already identified that street drugs are becoming increasingly toxic, increasingly unpredictable, and people are experiencing or watching loved ones experience overdose injury, death. Just the risk is getting more serious each day, each week, each month. So I think people are wanting to test their drugs to know for sure, like, is what they're being sold? Is that really what's in it, or are there some other adulterants in there that could put them at risk? So um, um, unfortunately, we can't allow people to test on the property, but we provide these take-home kits that are really simple to use, and you've seen that can be used in just a minute or two. And so with that, it's simple for people to test for these three substances. These three substances are odorless, tasteless. You can't see them with the naked eye. So drug testing is really the only way to know whether or not they're present in a sample. And so how people access, we have the test strips available at our public health office. We also take them with us anytime we go to outreach. And we've partnered with 7 other community organizations just to make it more accessible throughout Grey and Bruce.
You mind sharing who some of the organizations are so that people listening would know if they don't want to come to the health unit or they can't get to the health unit, where else could they go to?
Certainly. So Safe and Sound in Owen Sound, the Saugeen First Nation Wellness Clinic, the Nawash Unceded First Nation Health Center, the RAM program of Bright Shores Health Services, and also the Wellness and Recovery Center, CMHA Grey Bruce at their various locations, the Southeast Grey Community Health Center, and SOS, or Supportive Outreach Services.
That's really helpful because it says to me that there's a variety of locations. It's not just one location, one, and it's important that people are able to access. Now, your hope and health unit hope is that if people find that there is a substance in there that is dangerous and potentially could lead to toxicity and an overdose, or a poisoning, I think is how you phrase it now. What is your hope that they will do as a result of this test if there's something in the substance that's alarming?
Yeah, we're hoping that just the knowledge of what's in there or not will equip people to decide what level of risk they will engage in. And actually, we heard from our sample of clients that 75% of the time, people either used a smaller amount or started with a smaller amount, like start low, go slow. They made sure to have a friend present, or they changed dealers based on the dealer's policy related to drug testing. And a number of people discarded the batch or returned the batch. So those are very encouraging results.
And we're going to talk more about what you've found as a result of this. But I know you reference a harm reduction program. But what I'm hearing you say is this is potentially a life-saving program, the drug test strips.
Yes, definitely. Yeah. If you can know that something that you would potentially be exposed to is poisonous, fatal, or not, then you can make the decision to refuse exposure to it.
Yes. So the initiative that you've done, can you tell us more detail? Things like the number of strips that you've received, and then what you learned from this program, because it was a pilot for 1 year, is that correct?
The pilot ran from April to October 2024. And from OHRDP, we received 1,250 of each type of drug strip. And like I mentioned, we partnered with those 7 community organizations to be able to get the strips out across Grey and Bruce. And so over that time, April to October, 3,000 test strips were provided to people across the region. And there were sort of four results that we noticed throughout the pilot program. So the first one is that the clients really liked the test strips, and many expressed appreciation for the availability of the kits. This is something people have been asking for a number of years. The second is that service providers told us that since offering test strips, clients are more open about discussing substances and test results. And this information helps inform community alerts and one-on-one information sharing about the toxicity of the drug supply. Conversations about the test strips also help build rapport between service providers and clients, and this opens the door for discussion about readiness to change and reintegration into mainstream health and social services. The third thing we noticed is that the initiative actually attracted new clients to harm reduction programs in Grey Bruce, including family members of people who use drugs. So our data shows that 11 new clients visited to access test strips who had not previously used harm reduction services. And this number is probably an underestimate of the true number of new unique clients. And that's what we heard also anecdotally from service providers is quite a number of new faces. And the fourth outcome that I already hinted at that's very encouraging is that test results did lead to more careful use. So 3/4 of people that reported on their results said they either used a smaller amount, used more slowly, made sure they had a friend with them, changed dealers, or rejected or disposed of the substance completely.
So really interesting findings. Was the health unit surprised by the results?
I think it's not surprising. It's very encouraging, certainly, and I think it's what we expected to see. Maybe the surprise is just the volume of new folks that we're reaching with harm reduction services.
Right. Now, other health units, are they participating in this program as well?
I believe a number of other health units did opt into the supplies that were freely available. I'm not totally sure on which ones did or didn't. And now I expect that most other health units have run to the end of their pilot program, and now it's on health units to decide whether or not they will continue funding the test strips out of pocket.
Which leads me to one of the questions. What are you going to do here in our area about the funding of these strips?
Yeah, based on such positive results, we're pleased to continue offering the drug test kits as budget allows. We do want to continue to give people the tools to know with better certainty what is in their drugs or not so that they can use more safely or even discard the drugs. So we hope the kits will also continue to pave the way for better engagement with clients and to reach new clients with supports as they need them.
So it becomes part of your budgeting process on an ongoing basis?
That's right.
Yeah, so it was a pilot, as often happens with pilot projects, you get, and then you have to assume, okay, how are we going to continue on with this as well? Yeah. So are there other drug checking services that could be available? You've explained what the public health is offering. Any others?
Yes, so the SOS team, or Supportive Outreach Services in Grey County, has also recently begun offering more detailed drug checking services through their mobile units. So they have a mass spectrometer machine, and the major benefit to this service is that it does offer more detailed information about the contents and how much of various substances is in a sample of drugs. And it was sort of by coincidence that this also became available at the same time. So SOS is available Monday to Thursday, 8 a.m. to 6 p.m., and they can meet clients throughout Grey County. Their testing is offered in as little as 2 minutes or as long as 15 minutes for more detailed reading.
Excellent. What did you discover around the disadvantages or the shortcomings with these strips?
Yeah, there are a few disadvantages. So just by nature of the design, the tests offer limited information. They can only detect the presence or absence of a drug. They just give a yes or no. So there's no way to know how much is in a sample.
Yeah.
There's also the potential for false positives. So drug test strips do react with some other chemicals, which can cause a false positive, meaning the strip shows a positive result, but the target substance is actually not present. A major limitation is the fact that unregulated drugs are very inconsistent in terms of quality. So they're mixed unevenly, and some substances have the tendency to clump together. So we call this the chocolate chip cookie effect. So when you're making a batch of cookies, there will be a different number of chocolate chips in each cookie. And even within a single cookie, one quarter may have a number of chocolate chips and a different quarter may have none. So this just illustrates the unpredictability of the potency of street drugs. And for this reason, we encourage people to test their drugs before each use. And finally, oh, sorry.
No, that's okay. I want to find out more about these chocolate chips. So,
Yes.
so in a sample, if I had a sample, are you saying that depending on what part of that sample I tested, I could have a varying result compared to a different part of the sample?
Unfortunately, that's true. Yeah.
Wow. Wow. That's a bit concerning.
Certainly, yeah. And that would be the same potential outcome whether it's test strips that are being used or if it's being used in a drug checking machine, because in both cases you're just collecting a small sample, so it's not necessarily reflective of the whole dose.
Wow. Wow. So you talked about encouraging individuals to test every single time. So if someone uses daily or several times daily, they would need a variety of drug test kits, correct?
Yes. Yeah.
And do you set a limit to how many people can take at a time?
Yeah, that is a difficulty. So right now we're limiting to two of each kit per person per visit. Within each kit, there's enough supplies to run 2 tests. So bottom line, you get 4 tests per person per visit of each kind of test.
So it's still risky. You can test, which is important, but there's also still that risk depending on the frequency of use that someone may be practicing as far as
right.
using. Yeah. What else can you tell us about the services and why these are so important? You know, people will often have said, well, why are we doing harm reduction? Why are we not doing treatment and helping people? So maybe you can help to fill in that understanding about the differences.
Sure, yeah. I see harm reduction as part of a spectrum of services that includes treatment. And harm reduction is about, to me, like helping keep people as safe and healthy as possible while other solutions are made available or even in some cases developed. So drug checking specifically, it's a tool. It's definitely not the be all end all. There are some significant limitations, but it does help improve the safety of people who use drugs. Also helps to get them better connected into mainstream health and social services, and that's a major benefit in my eyes. That a number of the people that I see are just so removed from mainstream services that in some sense it's nearly impossible to access treatment. It's drug test strips and harm reduction. They're both a stopgap solution to the toxic drug tragedy, which seems to worsen all the time. So these help buy time for people. It helps them survive until they can access addiction treatment and wraparound support. And it helps just be a place where people can be connected and be part of a respectful and helpful community.
You used a phrase, I think I captured, I made some scribble notes, but we talk about, the drug crisis and that, but you use the phrase tragedy.
Mm-hmm.
And that really struck me, and it's not a phrase I've heard often, but it is a tragedy in that it doesn't just affect the individual, it affects families, it affects community, it affects service providers. So that was an interesting phrase, and it captured me for sure.
Yeah, thank you. Yeah, I do see the language shifting a little bit. We used to refer to it as the opioid crisis. Um,
Yes.
and crisis to me is quite time limited, maybe a couple years. This story has been going on for decades now, and it's worsening year over year. And it's no longer limited to opioids. So, fentanyl for a long time was the major player, but as you can see from these drug test strips, there's other toxic substances that are causing injury and death. So, yeah, we're starting to hear drug, drug, drug poisoning tragedy um, as opposed to opioid overdose crisis.
Yeah, yeah. Interesting. And, there's power in words, right? Definitely power in words. So let's say someone comes in, let's test the sample in their own environment, and it's truly, truly toxic. So no matter what, it's toxic. What do they do at that point? I mean, how do you dispose of something like that? I mean, obviously you don't want it brought to your place, right? The health unit. What do people do?
The safest way to dispose of a substance is submitting it to police services, and this can be done in anonymous ways, and they have the resources to destroy the substance safely.
And so, and that's important for people to be comfortable to know that, the police are there also to help in this whole system of care. Because, and to dispose of substances is important. We often talk about treatment and also behavior changes, right, around addictions. Is there ever any anticipation that the behavior may change as the strips indicate more and more of toxic supply?
Yeah, I guess that also relates to like what options are available, and so for a number of people, for various reasons, um, the the substances that they need to address um, certain needs is they have come to find only available by the street supply. So yeah, we do see some positive behavior change in terms of reducing risk because of the test results. But for some people, they just have very limited options for um, how to access what they need.
What would you like to say to the community about how to support the initiative that the health unit is doing, not health unit, I'm sorry, that public health is doing, and how the community can support in this tragedy?
Yeah. So in terms of the drug test strips, I think sharing the information with friends and family who may benefit from using the drug test strips, or even picking up um, picking up the kits for yourself and bringing them directly to people that would need them. Um, Stigma continues to be a major barrier for people to access public health and other health and social services. And so sometimes just if a trusted person can bring the supports directly, that can be a huge help. Um, for harm reduction in general, I would say the biggest thing any individual can do is to reflect yourself on your own values and beliefs related to substance use, related to people who use substances. What are some maybe underlying messaging that you've heard throughout your life that has contributed to the way you view the situation, and just um, critically examine your own position and what you're seeing around you. Um, for me, getting to know real people that are experiencing substance use disorder or harmful substance use has been the biggest impact in how I understand the situation and how I can contribute to the solution.
That's really, really helpful. So we've got a couple of minutes left in the program. And when I was reading through the information that was sent to me, you do have a budget, but every budget has its limitations, right? So as you are able, you distribute the test strips. Um, you, does Could the community participate by donating funds to assist this program? Like what other ways? Understanding is important. Getting to know the individuals who use drugs as individuals are important. Recognizing this program keeps people alive one more day to be able to reach out for help. What other ways?
Yeah, that's a great question in terms of financial assistance. I'm not very familiar with the inner workings of like public health budget. I know there are some sort of limitations to like accepting donations. So that's something I would have to take back to our financial department to find out more on. Um,
But the
yeah,
other organizations you mentioned, like Safe and Sound and others, do accept
that's
donations.
right. Yes.
So there are ways, even if public health has limitations, supporting the organizations that
Charitable.
also, yes, that
Yes.
have charitable status, would certainly be a way that the community can participate as well. Um, Anything from you, and as you move forward with this, any key learnings, anything that you might change as you move forward with the program?
Um, I would like to see it. So we have a number of what we call needle syringe program partner sites. Um, in a world with unlimited resources, I would like to see every NSP partner site offering the drug test strips just to further our reach geographically and demographically. Grey Bruce is a huge area, and so just to see the strips and other harm reduction supports available just more throughout the community, I think would be the next step.
Excellent. So there certainly are opportunities for this program for sure.
Definitely.
Heidi, I want to thank you for being on the program and for sharing this information. Really, really important and important program to keep people alive who are part of our community. Thank you so much, and I look forward to having further conversations with you as this program continues to roll forward. So thank you for being on the program.
Oh, thanks so much for having me. It's been wonderful. Thank you.
And thank you to our viewing audience for joining us today to learn more about programs, services, and resources available to you and to your family. Take care. Stay safe.